I want to tell you an interesting story about one of the first times I visited my own dental hygienist years ago after I got out of dental school. And so she was cleaning my teeth and she said, "Doctor, there's an area here that you're missing. You're not cleaning." And I said, "What do you mean me? I'm the dentist. I don't know how to clean my teeth." And so she just gave me a mirror, pulled my cheek back, and showed me along the gum line where all this stuff and bacteria and white gunk was building up along the gum line. And I thought to myself, you know, I'm a dentist. I'm supposed to know how to brush my teeth. And how come I don't know how to brush my teeth? There's something wrong with this picture. So what she did was, she didn't argue with me. She didn't lecture me. She didn't put me down or anything. She just said, "Show me how you brush." So she gave me a toothbrush, and I, brushed all over like this, da 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 da. And she said, "Okay, that's fine. This is what I want you to do." So she put her hand over my hand and so said, "Okay, I want you to brush along the gum line back and forth, all the way around, and follow a pattern, and then reach as far as I can, and then come back and overlap, and then continue all the way around the outsides, then continue all the way around the insides. Don't jump around like this and skip around. Just follow a pattern all the way around the insides.
Okay.
And then do the outsides of the uppers, insides of the uppers, inside the uppers." And so after she showed me how to do that, I began to wonder, really what's wrong with this picture? Because I'm supposed to know how to clean my teeth, and I'm not able to clean my teeth. And if I can't clean my teeth, how do I expect my patients to? So what I decided to do is invent an automatic electric toothbrush, which I did, and I got United States and Canadian patents for it, and I also did a whole bunch of clinical testing on it. And one of the things I did was I had people use this automatic electric toothbrush that I invented, plus a regular manual toothbrush, and then compare the results between the two. And one of the interesting things I found at the end of the study was that some people using the old-fashioned toothbrush did a better job than somebody who's doing the automatic electric toothbrush. And at that point I realized it's not the brush that makes the beautiful painting, it's the artist using the brush. And so it's not so much the tool that you use, it's the technique that you use.
Right.
And you might have seen it advertised on TV, these little washer things you put on the end of a hose, and it's kind of a wand, and it rotates and it foams and it cleans a window of your car or something like that. Those things are great, they do a good job, but they only work where you put them. So if you're washing a window and you miss a spot, it's still going to be dirty. Same thing with electric and a manual toothbrush. They're both very effective, but it's only the your technique, you're being able to reach into all of those areas. So that's why I've taught people how to do gum line brushing. Now I did research, all different kinds of toothbrushing. I did, the rolling technique, from the tooth to the gums and the gums to the tooth, and the jiggle and all of that stuff, and the 45-degree angle. And I found out what works the best is a good old back and forth. Going in circles is pretty good, but the rolling, I've seen so many people end up with gum disease and cavities and all kinds of problems. And dentists and hygienists say, "Well, no, you shouldn't, you shouldn't brush your gums too hard. Gums are gonna go away, or you're gonna saw your teeth in half." That's not true. You may get a little bit of gum shrinkage, some wear on the teeth, but nothing significant. These other people that didn't brush their teeth adequately end up losing teeth and have serious gum disease. I saw a picture of a lady, 96 years old. Her teeth are practically worn in hourglass shape. But guess what? At 96, she had all your teeth. So as long as you use a soft toothbrush and nothing too hard, you're not going to wear away all your teeth and gums, but you're going to do a good and effective job of cleaning them. So I invented this electric toothbrush and found out that actually what it does, electric toothbrushes do, is give you a false sense of security. Because, it worked only where people were putting it. And if you weren't putting it in the right space or right place, you weren't getting it clean enough. So what I want to do is I want to show you how to be able to get in a gum line brush along your gums to make sure you get into those areas and clean that off. All that white stuff that builds up on your teeth, okay?
Okay.
All right, so I'm going to tilt you back just a little bit here.
Okay.
And we're going to get a toothbrush. I'm going to show you how we do this. Okay. And the main thing, as I mentioned before, is being able to follow a pattern, not jumping around. Because when you jump around, you lose your place. You don't remember where you brush your teeth. And besides, you're doing it practically blindfolded because you can't see all the way in the back of your teeth.
Right.
Okay. Okay, so what we're going to do is we're going to use this little wand here, which is a wireless television camera. We're going to take a look inside and show Desi how to brush along the gum line. Okay, so over here we're going to take a look, and we're going to inside. We can see Desi's teeth over there, and we have a regular old-fashioned toothbrush over here. And what I'm going to do is I'm going to go back and forth along the gum line. Can you see those toothbrush bristles brushing in along the gum line? And then it's just all back and forth. Can you feel those toothbrush bristles?
Uh-huh.
Okay, and then you follow a pattern. You don't jump around. Then you come around towards the front, and you go in and out like this. And you can see those toothbrush bristles brushing in along the gum line. You see them getting in there?
Uh-huh.
And then you just follow a pattern all the way around and do the insides of the uppers. So we're doing all the way around the insides of the uppers. Okay, now come back over here with the camera, and I'll show you. We're going to start on the outsides of the uppers, brushing along the gum line. Can you feel that?
Uh-huh.
You can see the way that looks? And what I'm doing is back and forth, following a pattern just like that, brushing along the gum line, taking more time than that, but just basically along the gums. It's probably more accurate and more appropriate. You say you should brush your gums and your teeth. Now I'm going to overlap, make sure I don't miss any spots. And brush along the gum line. You feel those bristles getting underneath the gums?
Uh-huh.
And then follow a pattern all the way around. And then you do the insides all the way around. You do the outsides all the way around. So you're not just jumping all over and missing places. And gum line brushing works, and I think it's actually the most effective type of brushing, as long as you do it gently with a soft toothbrush. Not too hard. You can actually take your soft toothbrush and run it under very hot water and get it even softer. So that's Skinny on doing gum line brushing.